Hello, welcome to My Restorative Physical Therapy. I'm Dr. Jenny Pruitt, and today we're going to be talking about acute disc irritation. So when we're talking about the discs in the low back, a lot of times the standard description is to think of the disc as a water balloon or a jelly donut. It's supposed to be a shock-absorbing structure in between the vertebrae in the spine. And so when we're talking acute disc irritation, I like to call it irritation rather than using the word herniation because none of us are human MRI machines and we don't know if you herniated a disc or not. And so it's a better term to use to me to call it an irritation because I feel like it covers things more broadly. And so hallmark signs of acute disc irritation is sudden onset of low back pain with a bending, lifting, twisting movement or any individual component thereof as well. So just bending, just lifting, just twisting can also cause this kind of strain, like a lumbar strain or acute disc irritation, or combining any of those movements also can. So a sudden onset of pain with that mechanism, a lot of times people will say, use the expression, I threw my back out, or my back gave out, or my back locked up on me and I fell to the ground because it hurt so bad, or it hurt so bad that I felt like I couldn't walk. So these are all signs of lumbar strain or acute disc irritation. Other things, you may have numbness or tingling or pain that radiates into the leg. Doesn't necessarily have to be there in order for you to call it an acute disc irritation. And your symptoms are typically provoked with bending, which is potentially how you injured yourself, prolonged sitting, and with cough or sneeze. So those are kind of the hallmark signs that I'm looking for. There are times when you should absolutely see a doctor for this, and they include the leg symptoms, so the numbness, tingling, pain in the leg is severe, like so severe your leg feels electric and you feel like you can't trust it to put weight on it because you don't know what it's doing. And then other signs of more serious compression in the spine would be bowel and bladder changes, so meaning you're peeing or pooping with increased or decreased frequency, or you are having accidents compared to your usual. So that's a sign that you should be seeing a doctor urgently. Also, an urgent concern would be if you have saddle anesthesia, so meaning you have numbness on your undercarriage. So wherever, if you were sitting on a horse saddle, the parts of you that would touch that saddle, the skin, if you have numbness in that distribution, that is considered a medical emergency. You should go to the emergency room, urgent care, whatever you are closest to. Uncoordinated gait. So we're talking like your walking is out of your control. You look like a drunken sailor. That is not a good sign either. And the last one we kind of touched on with the leg symptoms being really, really severe, but the leg is actually buckling out from underneath you. It's not getting good supply to recruit the muscles, and it's buckling out from underneath you. Technically, with an acute disc irritation, I'm not expecting those things, but it's more like if you're thinking that you have an acute disc irritation, but you actually have something more severe, those last few things are all signs that you have compression centrally of some nervous structures, and they need to be decompressed for you to be okay. So any of those signs are a medical emergency. You should see a doctor right away, okay? But when it does come to the acute disc irritation, if things are kind of that mild straining, that mild strain, feels a lot of muscle tightness, those kinds of things, mild numbness and tingling that goes into the leg, then this is the place for you. And I have some really great top tips and exercises to help get you feeling better. So if you're ready for those, head on over to the tip sheet.